To come to the stage, please. As Dr. Prasad Reddy Garu has said, that the incidence in rural areas is somewhat less, but unfortunately this gap is closing between rural and urban. We used to think the rural populations are protected because of good atmosphere, peace, etc. But India, due to the progress, the rural, they are living in rural areas as address, but their thinking is urban. They have the same thing, the televisions, the phones, everything. So it's rural living but urban thinking, that is what is dangerous. Anybody else, please, to the panel?
Yeah, definitely the waist circumference, when compared to the hip and waist circumference ratio, if you take the waist circumference, if it is more, then the incidence of heart diseases are high. So that means that is the obesity, the central obesity.
Central obesity. We're talking about central obesity, not BMI. People who have big belly and big hips and whose chest is less than the abdominal dimension, they are more prone for heart disease.
No, I think she's talking actually about the physical stomach. Stomach as a large organ, she's talking about, I'm not aware of it, but...
More incidence of heart disease, that's for sure.
We'll look it up, but it's
a patient who's less than 60 years come to the operating table, so most of the faculties, they say, oh, young patient has come for surgery. So most of the faculty will say very young patients have come for bypass surgery. But here, for some reason, most of the patients who undergo bypass surgery in our setup are less than 50 or 55 years of age. And we have operated even ladies who are 25, 30 years of the age also, a couple of surgeries, a couple of patients who are aged in that range also we did bypass surgery. So, yeah, we do come across.
Who is in your memory?
8, I think he got operated. We did surgery on a national swimmer. National swimmer. He underwent bypass surgery at the age of 28 years of age. So that was in 2003 in our hospital.
I think in the recent era, even my senior colleague Dr. Sukesh Kumar Reddy has told that even in the rural population, majority of the people are getting coronary arteries diseases, because might be the exercise previously manual work was more, and now even the farming also has become more of industrial type of they have tractors and all those, and that much hard work is not there. So we are finding even their population are affected by the coronary arteries, and they are also undergoing the bypass surgeries. And with the actually government scheme, this Arogya scheme, we are detecting many people having a heart disease. Might be previously this much evaluation was not there, hence we were not knowing actually. And now we know the quantum of disease which is existing. And she asked one question, sir, the distendable stomach. So actually there is a study of North Indian versus South Indian. There is a distendable study, the stomach parameters. Like North Indian diet has less distended stomach as compared to the South Indians, and they are relating it to the diabetes and all those other things. Because one of the conferences, one of the person has presented the paper for that. So they have sized the stomach with the other things, like not with the directly heart disease, with diabetes and other things. That's why they call the South Indians, especially, they are more prone for diabetes as compared to the North Indian population.
Anybody has any?
There's a lot of awareness among the general public also about the heart problems and heart-related problems. So these patients, they come for regular checkups sometimes, and then when they come for the regular periodic checkups, we detect the risk factors in them, either like high blood pressure, diabetes, increased cholesterol levels, these things. So when we tell them, then they take some precautions to, at least to control the risk factors. And then by controlling the risk factors, we can avoid some of these cardiovascular events. So there is still, there are some people who are aware of this.
Elevation, just once, and then afterwards they can do it every 5 years till they become 50, and after that probably 2 years or something. But it's not asking for much. just going for a treadmill test which just takes around 10-15 minutes and getting a blood test lipid profile, especially people who have a strong family history, is not asking for much. And it's going to save their life, their family, you know, the breadwinner will be saved, so I think it's not a bad idea. See, what we are seeing is only tip of the iceberg. See, actually in Andhra Pradesh, the diseases are increasing day by day. See, initially Argostry people thought, the Star Insurance people thought that, you know, like once we operate, you know, for a couple of years, almost all the diseases will be over. But they are finding now that more number of cases are adding up day by day because the access for the healthcare, healthcare has percolated to villages and towns, and more people are getting detected to have heart problems. Manual laborers, rickshaw pullers, auto drivers, lorry drivers, so many people are coming with coronary disease at the age of 45, 50 years of age.
I have a question for Dr. Prasad Reddy garu. Before that, I want to mention to our invitees and to the press that the Honorable Minister for Health, Dr. Ravindra Reddy, he was supposed to have come, but as all of you know, since you cover this quite a bit across the street, he was summoned to Delhi this morning, so he is on his way to Delhi, or his echocardiogram or carotid Doppler, or should it be staged in a society as a screening, for health screening?
As a general screening, I don't think we'll risk factors. Like if they have a high blood pressure, diabetes, and high cholesterol levels, then advanced screening like treadmill test and if necessary CT coronary angiogram may be necessary. But in a routine general evaluation, we'll just check the blood pressure, the blood lipids, and the patient weight, and whether the family history of coronary disease or any smoking or these things, we'll make a note of it, and then we'll treat the risk factors accordingly.
Dr. Venkat, in that, let us say, Mechel area itself, when you treat patients for heart disease, how is the follow-up? Are they able to come back to the follow-up or not in that area due to their different socio-economic structure?
Hello. Actually, because of this Arogyasri scheme, where we are seeing most of the patients, at least they are coming for 1 year follow-up every month or so. But after 1 year when we are operating, they are lost in this one because the Arogyasri scheme of maintenance of drugs and all is given only for 1 year. Then later on we are not able to find out, sometimes we are even telephoning, they are not even calling them up, and they are usually not that particular. So I think definitely villages, they are not, regarding the follow-ups, they are not very well particular about those things. Only first 1 year, because we are, even the Arogya 3 scheme people also, they call them, and we also try to see them how they are. So we are able to follow up for 1 year.
I have one question for this. And if they have a full-time job, when is the resumption? If they have no problem.
I think after 1 month, some of them who are doing the office jobs and all, they are doing it. Only still the village, what is happening here, one of the things what I have seen in Puttaparthi and all, that there is a mobile hospital service. They go to the villages and they train the people and they do rehabilitate. They give education to the people to walk and to do normal work and all those things. But we are not able to sustain to that level of prevention, secondary prevention. So I think to coming back to, I think the villages are take time to come back actually. But
paper kadandi?
Yeah.
If you can't do it, I may ask surgeons to do it. Maybe we need minimally invasive surgery here. Bhanugari, come and చూపించండి. As a hospital that has tremendous responsibility for the health of the citizens of Twin Cities, Mediciti Hospital has undertaken screening procedures for, and this is our responsibility for the citizens of Twin Cities. We'll ask him also to come. ఇంకా ఉండాలా?
Cardiologist and my senior colleague, once again a happy World Heart Day. We are very happy. This time Mediciti Hospital is coming forward with such a big campaign and helping the patients who are having heart disease. And being a part of the team, we are again much more happy. Under the able guidance of Dr. Sukesh Reddy, in the whole of city, that center, that hospital which is doing the more number of cases, I am talking about the hospital, not the surgeon as such. Mediciti Hospital still stands first in the hospitals wise doing minimal invasive cardiac surgery. The idea of minimal invasive cardiac surgery is to decrease the morbidity, that is pain to the patient. Instead of cutting the difficult procedure to do.
Sir, invite all the cardiologists at the end. Dr. Naveen, all cardiologists.
Okay.
Okay, at the conclusion of
At the conclusion.
Just 10 minutes before, there was discussion, what is the rehabilitation time and rehabilitation period for the patient post cardiac surgery. That is very much lessened by doing manual access cardiac surgery, where we can discharge the patient within 3 to 4 days. And scar is not seen, it's a cosmetic surgery, and any young girl who is supposed to have a cardiac surgery, open heart surgery, can get married happily without any social stigma.
You have any questions, Andy? Oh, ఇది ఎందుకంటే ఈ ప్యాకేజీ కార్డియోవాస్కులర్ రిస్క్ ఫ్యాక్టర్స్కి కొలెస్టరాల్, షుగరు,